KMAX Matthew Stell sat down with the director of the health department to talk about how to curb the problem in our nursing homes tonight.
Captain Wills says one of the easiest ways to curb that problem, Brian, is making sure the employees that work inside those nursing homes are also doing their part.
Having 100+ cases a day in Lubbock is too high.
It's a resurgence of cases as Lubbock reopens that has local health officials concerned, especially when it comes to our nursing homes.
We're hoping it wouldn't happen, but not too surprised since we have so much virus circulating in our community. The likelihood of a worker or even a resident of a facility having to go out to an appointment and contracting the virus at that point is possible.
But one of Wells' main concerns is employees bringing the virus inside a nursing home. That's why she's instructed her staff to monitor facilities for what she says may be any gaps in infection control.
Did people get lax about hand washing, or people stop taking off a mask correctly?
Why she's so worried, you ask? When Lubbock firefighters tested every nursing home back in May, not one resident came back positive. But fast forward to over a month later, Bender Terrace and most recently Crown Point Rehab combined have had at least 40 confirmed cases within a week.
Kind of what went on with Bender Terrace shows you how quickly something like this can get introduced, because 30 days prior, everything was screened and we didn't find anything, and then going back in and finding cases that quickly.
And if mom or granddad live in those vulnerable places, things won't be changing, and most likely for a while.
I know phones aren't the same. I know it's hard to visit through a window. I hear from people every day, but we need to work to try to keep this virus out of these facilities.
And something that's come to an end, moonlighting. That's when nursing home employees worked at multiple facilities across town. Wells strongly believes that practice may have played a big part in the early spread of the virus at places like Whisperwood. Brian?
All right, Matthew, thank you.